Good morning, YouTube Live. I am setting up Instagram Live right here, and we'll get started with the PT on Ice Daily Show. Looks like Instagram is loading, so I will get started in just a minute here. Good morning, PT on Ice Daily Show. We are live on Instagram and YouTube. My name is Dr. April Dominic, and I am one of the teaching assistants for the CMFA Pregnancy and Postpartum Division. I'm so excited to be here this morning. Today we'll talk through one of my favorite topics, pelvic floor cues for any clinician to use. Before I dive in, let me run through a few course opportunities coming up in the CMFA PPP division for you to take advantage of. We have two options for learning with us. One is our online cohort, the other is our live 2-day course. Our next 8-week course begins January 10th, 2023. This course will help you work with a female fitness athlete and allow for effective management of their unique needs and considerations as far as pregnancy and postpartum goes. We also have our 2-day live courses. These courses bridge the gap between pelvic health and the fitness athlete. It's unique in that we teach about all things pelvic floor, including the internal standing muscle assessment. And then day 2, we head straight into the gym with hands-on labs for pregnancy modifications for the barbell, gymnastics, and endurance exercise. Dr. Alexis Morgan will be kicking off our first live course of 2023, the weekend of January 21st and 22nd in Elmhurst, Illinois. This is near Chicago. Then all of my fellow Texan PTs, Dr. Christina Previtt and Dr. Rachel Moore, will be hosting the course in the Woodlands, Texas, February 18th and 19th. Visit PT on Ice to reserve your seat in one of these courses, and we hope to see you live or in person. Let's dive into today's topic. So 100% of your clients have a pelvic floor, but are you, as a provider, appropriately cueing how to activate or relax it? For our agenda today, we'll briefly go over where the pelvic floor is, its main functions, 2 categories of pelvic floor tone, and my top 3 cues that you can use in the clinic tomorrow or today, geared towards pelvic floor activation or lengthening. This is going to be for any pelvis owner. The reason I picked this topic is because teaching pelvic floor muscle awareness is challenging. We can't actually see these muscles as easily, especially in a really busy gym or clinic. We don't have the luxury of getting the same kind of visual feedback that we do when we ask someone to activate their glute or eccentrically lengthen the bicep, and we can watch the elbow extend. I hear from my clients that fitness instructors and other providers are incorporating the pelvic floor in their sessions, usually more about the pelvic floor squeezes, but rarely relaxation. But by the time these clients get to my office, they still don't seem to know exactly where the pelvic floor is, and even though they've been supposedly working on it for a while. Don't get me wrong though. I love that the pelvic floor is even being brought up in these spheres, because it seems as though it's a muscle group that's often forgotten, which is wild to me, given all of the essential functions that the pelvic floor contributes to. But we need to make sure as providers, whether we treat the neurologic conditions or clients with general orthopedic injuries, no matter our specialty, we feel competent to provide different cueing options besides squeeze your pelvic floor, relax your pelvic floor. So first things first, where is the pelvic floor? Normalize the pelvic floor with your patient. Get comfortable pointing it out on a model or on a picture. I like to break it down for my clients. I say, the pelvic floor is the only thing that's between your legs that's holding everything up. Think of the pelvic floor muscle group like a funnel. It's tucked inside the pelvic floor and it's inside the bony bowl. It spans from the pubic bone anteriorly all the way back towards the coccyx posteriorly, and it has wings that drape across the lateral walls of the pelvic bowl from left ischial tuberosity to the right. There are other important connective tissue pieces that are part of the pelvic floor, but today we're talking about the contractile tissue, the muscle. What people don't realize is that while some of the pelvic floor muscles are deep inside the pelvic bowl, they're internal, others are palpable externally, even over clothes. There are three main layers of the pelvic floor musculature. We have the most superficial layer, the urogenital triangle. That can be palpated externally at the base of the penis or near the vaginal openings. Then we have the urogenital diaphragm, and then the deepest layer, this one is called the pelvic diaphragm. That's going to be the one when you Google what is the pelvic floor or where the pelvic floor is, that's the image that you'll typically see. So dust off your anatomy book, do a Google search of the pelvic floor, or check out some of our other PPP on Ice, PT on Ice daily shows or courses that dive deeper into the muscles so that you can get comfortable saying pelvic floor, vulva, and penis in a professional setting. Let's review the main functions of the pelvic floor that include 5 main functions. One is the sphincteric function. The urethral and anal sphincters maintain a low resting tone to keep urine and fecal matter in, as well as to relax when we're ready to allow all of that to empty. The pelvic floor also plays a role in organ support. So it helps to support our rectum, our bowel, or our bladder, our prostate, the uterus. It contributes to stability of the lumbar spine and the core. And then it's also involved in sexual function, particularly sensation and arousal, and contributes to circulation to get some of the blood pumped back to the heart. So ensure that your client understands the functions of the pelvic floor. Make it meaningful to them, the role that it has in many of their daily activities, like peeing or intimacy. Explain its role in the spine or core support when they're deadlifting or running after kids. So let's talk about low tone versus high tone categories. So just like any other muscles in the body, a simple way to think about categorizing the pelvic floor during an assessment of your client is with 2 buckets, low tone or a pelvic floor with high tone. Though one pelvic floor may not fit into one bucket perfectly. First, let's talk about low tone. These are the humans who may experience heaviness in the pelvic floor or leakage. Think of a patient that complains about the number of pads they use daily, or the patient who says, I've not really ever had a core since I had my C-section 5 years ago. You may note that these people have difficulty activating some of the surrounding musculature, like the abdominals or the glutes, and we can broadly categorize them into low tone category. These people would likely benefit from cues emphasizing strength and endurance of the pelvic floor. Let's move to our second bucket, the high tone. These would be our butt or abdominal grippers. These humans may report pelvic or hip pain or pain with penetration, trouble fully emptying the bladder or bowels. You may see them going to the bathroom quite often during your 1 60-minute session, if you're lucky. And then we can also think about the excessive hypermobility. The people who have excessive hypermobility, they can have high tone and try and be gripping to stabilize themselves. So when we're looking at surrounding musculature of these humans, you may note increased tenderness to palpation in the hips and the abdominals. They may tend to clench their jaw. So these folks would likely benefit from lengthening or cues to relax the pelvic floor. Clinically speaking, I often find that relaxing the pelvic floor is equally, if not more important than strengthening the pelvic floor. So let's dive into my top 3 cues. Before we do that, remember that you can utilize physical biofeedback with palpation to bolster your pelvic floor training. What do I mean by that? Ask your client if you can palpate on the inside of their sit bones or nearby their sit bones so that you can just get a gross assessment of their pelvic floor. This can be done over clothes or in different positions like supine hook lying, side lying. If they prefer you not to palpate there, that's fine. Ask them if they feel comfortable placing their fingertips there. Then get their feedback. Ask them, do they feel anything? You may be thinking, April, I'm not an internally trained pelvic floor physical therapist. I'm a sports PT through and through, or I'm an acute care PT. What if I pick the wrong cue? If you try one intervention for the pelvic floor, such as having the client strengthen their pelvic floor, and it doesn't work, you can always try the opposite. So remember, some cues work brilliantly for individuals, but others don't seem to click. So that's why I've included some with a lighter cognitive load for, say, the mom who has 3 kids, or the pediatric client, or someone with a neurologic condition that affects their cognition. I also provide you with a cue that's a little more detailed, maybe with the athlete who has a higher body awareness. Each of the cues will touch on either the anterior, middle, or posterior part of the pelvis. As I give y'all these suggestions for verbal cues, I want you to try them out with me. Whether you're on your way to work right now or on a walk, try them out. So, the mnemonic that I've come up with that represents a key word in each of the 3 cues I'm giving you is AJS or AJs, okay? Anus, jellyfish, sit bones. With each cue, I'll give examples of both pelvic floor strengthening or pelvic floor relaxation, depending on whatever it is your client in front of you needs. So the first keyword was anus. To cue a pelvic floor contraction using this keyword, ask your client to squeeze your anus. Okay, squeeze the anus. If you want to expand on that a little bit, you could say, squeeze the anus like you're holding gas in. This is a great cue as it's relatable to any pelvis owner. Everyone has an anus. There was a study done by Ami and Dar in 2018, and they looked at females using this cue. They found that 90% of the females demonstrated a proper pelvic floor contraction when they assessed with the transabdominal ultrasound. They looked at the pelvic floor displacement. If you want to use the anus cue for getting your client's pelvic floor to relax, you could say, expand the anal canal. All right, the next cue, the J of the AJS mnemonic, jellyfish. Set the stage for your client. Think of a pelvic floor moving like a jellyfish swimming in the ocean, drawing its tentacles up and down as it glides through the water. With this cue, we'll make it specific to certain genitalia. To promote strengthening of your client's pelvic floor, if they have a vulva, you could ask or say, squeeze around the clitoris and lift up as a jellyfish would draw its tentacles up and in. For penis owners, you could say, shorten and lift the penis like a jellyfish drawing its tentacles up and in. A study done in 2022 by the same lead author as the previous literature I mentioned looked at penis owners and found that greater than 90% of participants completed a correct contraction of the pelvic floor with the cue, shorten the penis. So to relax the pelvic floor using the jellyfish keyword, you would say the opposite. let go around the clitoris, or lengthen the penis, as a jellyfish would drop or relax the tentacles out. The reason I like the jellyfish cue is because it speaks to the reflexive and dynamic nature of the pelvic floor. It celebrates both movements in both directions of the pelvic floor, both a squeeze as well as a relaxation or a drop. That's the one that's often missed in pelvic floor training. Finally, our third cue, the S of the AJS mnemonic, sit bones. If you're wanting your client to activate their pelvic floor, ask them to shorten the distance between the sit bones. If you want them to relax the pelvic floor, ask them to separate the sit bones. Asking someone to find their pelvic floor can be like finding a needle in a haystack. They're confused, you're confused, you feel awkward, they feel awkward watching you stumble through saying the word vagina, or they're getting flashbacks of their high school sex ed class. To avoid that, team, be sure that you're familiar with the basic pelvic floor anatomy, its functions. Recognize that we can categorize someone's pelvic floor into low tone or high tone, but there can be some crossover between the two. So let's recap the top pelvic floor cues using the AJS or AJ's mnemonic. If you want to help someone contract their pelvic floor, try any of these cues. Squeeze the anus, like you're holding gas in. Squeeze around the clitoris and lift up or shorten the penis as a jellyfish would draw its tentacles up and in. Shorten the distance between the sit bones. Conversely, if you want to have someone work on pelvic floor relaxation, you could try any of these three cues. Number 1, widen or expand the anal canal. Number 2, use that jellyfish analogy. You can say, let go around the clitoris or lengthen the penis as a jellyfish would drop down and let the tentacles relax out. The final cue, separate the sit bones. It can be so fun to help someone meet their pelvic floor for the first time. This is something that I think any clinician should be confident in, no matter their clinical setting. Remember, folks with pelvic floor dysfunction should seek a pelvic floor physical therapist for a thorough assessment, but it can be so helpful for the client to have you help them with baseline understanding and attempts to connect to their pelvic floor. Also, someone doesn't have to have bladder or bowel difficulties or pelvic floor dysfunction for you to be able to incorporate the pelvic floor in their treatment. As we discussed, the pelvic floor has so many huge roles in the stability of the lumbar spine and the core. So, team, practice your pelvic floor cues on yourself. Let me know which ones worked for you or any others you found helpful or useful in your practice. Happy Monday. I hope you'll have a great week and an awesome end to 2022.